research, you're trying to answer a question and prove or disprove prove a hypothesis. So you're trying to get knowledge that would then maybe transfer to other areas. Measuring for improvement, you're quite right, Bobby, is about looking at things, whether things are improving or changing at all in the real world setting. Yeah, and targets are about whether you're meeting or something that's set externally. So yeah, research, for example, might be how a patient responds to a particular drug or treatment. Targets is about comparing performance with a known standard. Quality improvement is looking at data, especially over time. So the thing about quality improvement data is it measures over time to see whether things are improving or not. All types of data have to be carefully defined so that you can really make meaningful conclusions. That's something I'll talk a bit more about later. So we talked about the model for improvement earlier, and measurement for improvement is a key step in this model. So it's the middle question here. How will we know that a change is an improvement? Are we moving closer to achieving our aim? And there are 7 steps to measurement for improvement. So you've got to decide on your aim, which we all did 2 sessions ago, or in between the first and the second session, actually. And then you've got to choose your measures. And we'll talk about that today. And really define them carefully so that everyone's on the same page. Then you've got to collect and think about what are you collecting, when are you collecting the data, who's going to do it, how are you going to do it, and remembering the baseline, so data before you change anything. Then you analyze and present it, review that, making sure you're getting the results that you're expecting, making sure you're measuring the right thing, and then you keep going. So you do 4, 5, 6 again throughout your project. And the team will decide on your measures and goals. No one else is going to be from you. It's for you to decide what you need to know in order to measure the impact of your project. And the focus is really on improving local services. It's not about achieving a target. It's not about creating knowledge that can be used widely across the NHS. It's about your service, your unit, and improving things on the ground for patients being treated at your unit. So anyone thinking about cheating the data or want to skew it a little bit, it's completely useless, because we really want to see the problems. It will be a bit like cheating yourself, because quality improvement measurement is about seeing a whole picture, trying to identify any problems before you then go and implement a change wholesale, rather than trying to hide them. Not that any of you would do that. So why do we need to measure? It's really important to understand what impact all your hard work is making. So that's why we first need to do some base measurements so that we know where we're starting from. And then we keep measuring at points during our project so we can see if what we're doing is making things better or worse. So by continuously measuring, we can understand if we've made any difference at all. And then we can understand if that difference is what we're hoping it to be. So if it's an improvement. And then we can, in due course, understand whether we're maintaining those improvements, so sustaining the change. And then finally, as we continue to measure, it might help you to think about what your next priority would be. There are 3 types of measurement in quality improvement. So there's an outcome measure, which is a clinical outcome. They're usually things that make things better, the outcomes that make things better for patients. They often take a bit of time to demonstrate results. Then there are process measures. So that's about measuring what you've changed in your processes in order to reach your outcomes. So you're assuming that with these process changes, a positive change will happen, a positive outcome will happen for patients. And you measure these along your project, and you can often get faster results by looking at the process measures. And then later come the outcomes that you want to see. Balancing measures can identify unintended consequences of your project. So think about those generally negative things that might happen on the back of your project. So I was talking to Yasar previously, he's doing a project, thinking about implementing a project about reducing thrombosed fistulas, and the impact it might have on interventional radiology time and workload. So that might be his balancing measure. What his outcome measures will be is a reduced reduced failure of fistulas. But a balancing measure will be the workload for interventional radiology. If you're looking at peritonitis, the outcome measure might be that rate of infection. Your process measure might be the % of patients who've had a refresher training in the last 6 months, for example. Another way of looking at it is looking back, thinking back to when COVID was happening, or still is actually, but thinking back to, you know, when COVID happened in March 2020, and the outcome measures everybody wanted to see when they looked on their TV screens every night was the reduction in numbers of people getting COVID. That was the outcome measure. But it didn't happen at first. Actually, what we saw was an increase. What the process measures showed were that there were fewer car journeys happening. There were more people being tested. So they were the process measures. And then COVID reducing happened later. And then the balancing measures perhaps might have been the impact on social industries like pubs or hospitalities. There's just some examples of how to remember those 3 types of measurement. The other thing around quality improvement data is just choose enough data. And this can be quite tricky, but you really don't want to be bogged down by collecting reams and reams of data. Just want to make sure you have collect the right data so that you know what you're doing is making a difference. So this usually looks like 1 or 2 outcome measures, maybe 2 to 4 process measures that are based on your change ideas, what you're doing, and then a balancing measure. And also maybe 1 or 2 experience measures. So think about how this feels for patients and collecting some element of patient experience as well. So just to get you to think a bit as well, what do you see when you see this chart? So this is about vaccination uptake between 2020 and 2021. Can you tell me what your thoughts are when you look at this chart? What do you think's happened? Just shout out.
Looks like there's been a big increase.
Well done, Helen. Yes. I feel like it should be, what's the program? We go,
Yeah.
Anyway, here we go. And this is what it looks like when you look over time at the data over time. So what can you see now from this data? If the intervention happened at 12 months. A new system was implemented at 12 months.
Got worse.
Like the new system.
That's right. A new system was implemented, and as Bobby said, it's got worse. So you can't always tell exactly what's going on by just having annual measurements, snapshots in time. If you just compare averages across years without knowledge of the variation before and over time, you can actually think an improvement has happened when it hasn't, or vice versa. So this chart shows a steady improvement, chart on the right, so it shows a steady improvement, but then now it appears to be declining, so it seems like something's gone wrong. So plotting data over time gives a better picture of what's really going on, and gives you an understanding of variation. And this is what's called a run chart. So run charts show your data over time, and there are statistics which you don't have to understand, but statistics are involved that help to show what's a significant change and what is just normal variation. And we'll go much more into detail about this in January session. But for now, just know that run charts help you to draw the correct conclusions from a set of data. So it stops you overreacting or underreacting to just the most recent data point or an average. Because if you understand what normal variation looks like, you'll know whether then when you make a change, what the impact of that change has been. And this is why we measure a baseline. So you understand what normal variation looks like before you make a change, and then you make the change, so you understand whether the variation is as a result of your change or not. So it's a really important step in order to know the impact of your project, is to baseline your measurement. So remember the 7 steps of measurement for improvement. So steps 4 and 5, the first time round, are what you call your baseline. And then by analysing and presenting that data over time, you understand what normal looks like. Then you make a change and you continue that cycle of measurement, see the impact by moving around the cycle again. So 4 and 5, the first time round, is understanding what normal looks like. Then you make the change and then you keep on the cycle. So the final point to say about agreeing measures is that before you start measuring, it's important that everyone is measuring the same thing. So, for example, if I asked you all to come to the next meeting wearing blue, what would that mean to you? Would it mean just putting some blue socks on, maybe a blue jumper, or would you have to come covered in blue from head to toe? Would you have to have blue face paint? It means different things for different people, and that's the same with measures. So it's just about really carefully defining what you're measuring so that everyone's on the same page and making sure everyone's got that understanding. So in summary, there are 3 types of measures in measuring for improvement. There's outcome measures, which are linked to your aim and clinical outcomes that have an impact on patients. There's process measures, which are the things that need to happen to achieve your aim. You also need to measure them for the duration of your project. And then there's balancing measures, and those measure the unexpected consequences of what you're doing. And because you're doing something in a real world setting, it's really important to have those measures so you get a full understanding of the impact of your change before you roll it out. So agreeing measures helps you to answer whether you know that a change is an improvement. You collect just enough data, try to automate it if you can, so you're not taken up by data collection. Define measures exactly and look at data over time so that you can understand variation.
To confirm who I am, my name's Leanne. I think I've met most of you. I work alongside Catherine in the UK Kidney Association in KQIP, and I cover the North West and Yorkshire and Humber region, so I do something very similar to Catherine, but sort of a bit further north. So I'm here to support Catherine and yourselves on quality improvement, and I'm going to talk to you about PDSA. So it's not the animal charity. This is Plan, Do, Study, Act, and this is how we test those cycles of change. So these are the aims and objectives. Like I say, this is not about the animal charity, just to make that really clear. So hopefully, you know, by the end of the 10 minutes, you'll have an understanding of what a PDSA is and how you actually use that to test changes. These are our lovely 10 steps. We absolutely adore these 10 steps because it's just such a methodical way of approaching any improvement. And we're on step 8, and I can't believe, you know, in the past, you know, we've been doing this, you know, this is our 3rd session, and already, you know, you've come through so much, you've learned so much already, but now we're moving into the action phase. This is us. We've planned, we know what we want to do. Okay, now we're going to test our ideas. So you all seen a driver diagram. This is an example of a driver diagram that we've done. So if you have any children of a particular age that are going through GCSEs, you're happy to pinch this with pride. But yeah, so we've developed a driver diagram for someone else, and you can see, you know, what our aim was, our drivers, and our change ideas. But we've got a lot of change ideas. So how are we going to decide what the priority change idea is to test and implement? You know, there's maybe about 10 or 12 change ideas there. So what we use is a prioritizing matrix. And this is, it's really simple to use. So what you do is you map out on this matrix your change ideas, what's easy to do that's going to give you the highest impact. You do that now. Okay, well, what's a bit harder to do, but it's still going to give us that high impact? Well, we need a bit of time to plan that. And then for those ones that have got low impact, You know, there's no point in doing them. So maybe we'll give that to someone else. We'll park that for another time. Right now, we're really going to look at those high impact interventions. And I've just pulled them from that driver diagram. So you can see there, out of that 10, 12, we're going to plan some flashcards. But you know what? What I can do here and now is make sure I've got enough refreshments. So you can see it's really, you know, we've kind of reduced that big list. So it's a bit more manageable now. I now don't feel as overwhelmed. Oh, I've got all these ideas. What am I going to do? So it's just a bit less overwhelming. And practice mindfulness, you know, there's no such thing as a bad idea. But when it comes to prioritising and putting it into this matrix, we decided actually that was really hard to do, and it's not really going to help as much. So we've just kind of parked that idea. So again, you know, it's another useful tool to use if you come up with ideas that's not going to give you a big impact on your project. And another thing that you can do, because we've got 3 prioritise and change ideas that are easy to do, high impact, we're going to do them now. What you then do as a team is you can then vote. Okay, well, what one are we going to look at first? And you very simple votes. You know, we're supposed to be in a democratic society, so we go with the majority of the vote, and that's how you would then whittle that down to just looking at one. So if we just focus on one change idea, we're going to test it. And this is what that looks like, this testing tool, plan, do, study, act. This is something that as healthcare professionals, we do this every single day. What we've done in quality improvement is we've given it a label. This is the quality improvement language as such, but you do this every single day. So whether you're giving a presentation or you're attending a meeting or you're going to talk to a patient, you plan it, you think what it is that you're going to say, you sort of predict what's going to happen at the end of that conversation. You then implement that, so you do it, conversation, you present, and then after you've done the activity, you then think, oh, what went well and what didn't go so well. And we always do this either commuting home, on the bus, in the car. For me personally, it's usually in the shower. Oh, that didn't go so well. So next time, I'm going to make some modifications. So if I do speak to that patient again, this is how I'm going to change my approach. I'm going to change my tone, or you know, my presentation. Maybe I just I steamrolled through it because I was nervous. Okay, so what do I need to do for the next presentation that I do? And then it's just a continuous cycle. So you're continuously looking, reflecting, implementing, planning, reflecting constantly through that one test, that one idea. So plan does what it says on the tin, and there's some questions that you can ask. So you describe what you want to see happen. So that's your aim. That's making a prediction. So if I do A, B, if we do A, B, and C in this test, we will predict that X, Y, and Z will happen. And this is a really good template, so you can fill this in. You describe your prediction, but there'll be a list of tasks. So Bobby needs to do X, Y, and Z. Helen needs to do this. Yasser needs to do the next one. So and then allocating those tasks and setting the dates. You know, when do we want this to happen? Because that really helps you to move your project on. And then you're going to observe. So you're going to run the test, but you have to observe what's happening. What's happening with their patients? What are they saying to us? What's happening with our staff? What are they saying to us? What does the data tell us if you're collecting data? And then you're going to compare. And again, there's a couple of questions that you can use there. So what happened when we ran that test? Well, X, Y, and Z happened. How does that compare to what we wanted to see? So then you move on to the next step, which is you modify. So you want to make those modifications to the next cycle, and then you go back to plan. So you'll plan what it is you want to do, those tasks. You'll predict what you want to see with this next iteration. You'll implement the plan by doing. Then you will study the data. What are people telling us? What's the data telling us? Okay, what modifications do we need to make? And this is the same change idea constantly. So you're going through these cycle of tests. So ideally what happens is you have an idea, you've got a change idea that you want to implement. You're going to test it on a very small scale. So you use that PDSA cycle on, for example, 5 patients, whatever it is that you want to implement. You want to test it out just on 5 patients, or it could be 1 consultant. And then you do follow-up tests. So you go around that loop, that cycle, as many times as you need to yes, we've got this right now. This is right for these 5 patients, for this 1 consultant. Then you would then spread the scale. You then spread the test to maybe 20 patients, 30 patients. Maybe we'll have 2 or 3 consultants testing out a change. So you're just spreading out the change. And then once everybody's happy, so all the consultants, all the staff, everybody's happy, this is the new way of working, we're going to implement that change. All the while, you're collecting data over time, and you will see on that run chart the impact that your change has had, because ultimately that answers that question in the model for improvement. What change can we what change can we make that will result in an improvement? So that's how you do it, and you can do these over a long time, or you can do them really, really fast. I've known people to do a PDSA over a week, and they just keep testing, right, we need to try this, we need to try this out, this is what we need to do next. Or, you know, it could be over a couple of months. So there's no great, there's no recommendation for implementing a test. These are just some top tips. You can actually have 2 or 3 change ideas that you're implementing, you're testing at once. Like I say, test on a really small scale. And the big thing, I think, is test it on the ones who believe in the improvement, who believe in this change idea. You know, those innovators, early adopters, the people who are championing your project, test it on them. And only implement, this is a new way of working, when there's no more improvements to be made. So when you look at that run chart and it's nice and steady, and there's no more variation in your run chart, it's nice and steady. Do you know what? This is our new way of working. We have to embed this now. We will share these slides. So there's a couple more articles there that you can read around PDSAs. And we weren't, this was the activity. We were going to prioritise and then plan our first PDSA. But we won't go into breakout rooms. We'll just have an open discussion, and we'll stop sharing and I'll take any questions.